Today I'm going to talk about what neonatal nurse practitioners are and the different roles that they perform on a daily basis. The National Association of Neonatal Nurses, also known as NAN, explains, neonatal nursing is a subspecialty of nursing that works with newborn infants born with a variety of problems ranging from prematurity, birth defects, infection, cardiac malformations, and surgical problems. Neonatal nurse practitioners' responsibilities to these diverse issues can vary because it depends on which level of care they work in. NNPs can work in either a level 1, 2, or 3 nursery. By completing the necessary education qualifications, individuals will have the necessary experience and training needed to be eligible to care for high-risk infants and work in all 3 of these nurseries. So let's start with level 1. Although for the majority of the time NNPs work with the infants needing critical attention, in this level neonatal nurse practitioners care for the healthiest babies. NNPs perform tedious tasks such as bathing, feeding, and changing diapers because these problem-free infants can stay with their mothers. Due to the small amount of care that is needed, this level to work in is becoming less popular today because the hospital stays have shortened for the mother and child. Because of this, the need for NNPs have become limited. Next, neonatal nurse practitioners can work in a level 2 nursery. This level works with babies that have mild health conditions, which may be premature birth or possessing a minor illness. Now, these level nurses are in much more demand than level 1 because premature and sick babies need constant attention. Some examples of possible treatments could be intravenous therapy, specialized feedings, or supplemental oxygen. Lastly, neonatal nurse practitioners can work in a level 3 nursery. This level is extremely important because NNPs work with the severely sick babies in the neonatal intensive care unit. They admit neonates, which are babies during the first 28 days of life, who cannot be treated in either of the other 2 nursery levels. Lucy Baines Johnson and Elizabeth Dole, who are both honorary chair members of the organization Nurses for a Healthier Tomorrow, give a description on level 3 infants by clarifying, these babies may be small for their age, premature, or sick-term infants who require high technology care such as ventilators, special equipment, incubators, or surgery. Since the babies are in desperate need of endless attention because of their high risk, NNPs are always on service. The neonatal nurse practitioner's constant presence in the NICU is a source of stability and consistency as they are most familiar with the patients, families, and policies of the unit. Depending on the infant's needs, they can be transferred across the nurseries for more or less care. Even though each level encompasses their own group of specific tasks, levels 1, 2, and 3 still relate with one another. Sue Turhill, who works in the NICU at St. James University Hospital, states, neonatal nurses' clinical roles are all based on the monitoring and control of the physiological stability of infants and decision-making in relation to interventions.